Well, I want to invite us to start with prayer, and then we'll kind of dive into some of this adventure.
Okay.
Oh, gracious God of Advent, as we come together in this season of waiting, there are so many things we are waiting for. We are waiting for grief to subside. We are waiting for sorrow to end. We are waiting for illness and sickness and death to be no more. And gracious God, in this time of waiting, we also are listening. And we hear your still small voice calling out to us, calling us to be balm in Gilead, calling us to be light in darkness, calling us to stand up and follow you and shine like stars in the world. Gracious God, fill us with your Spirit. Challenge us to action. And help us have the courage to live out your gospel. In Christ's name we pray. Amen.
Amen.
Well, I thought we'd start by doing some introductions, although we all probably know each other fairly well. I would love to hear, though, how you are connected with, or what your past experience is with malaria, or Africa, or Nothing But Nets, or Imagine No Malaria. Just to kind of give us some context for the conversation we're going to have tonight. So, my starting point with this is really with Imagine No Malaria. I knew about Nothing But Nets and we got excited about it, but I was still in seminary when all of this was getting started, and so this is kind of really the first effort, and I didn't know as much about it as I thought I did when I started this position, to be honest, and it's been amazing to learn about what we're doing. So. Well, thanks for sharing as we get started. Some of these statistics you may be familiar with, but as we think about the impact of malaria, in 2010, 655,000 people died from malaria, and 85% of those were children under the age of 5. And so just knowing that reality of the impact on children is really important. And when you do the math, that means that a child's dying every 60 seconds from malaria. And that's just too many. And it's especially tragic because we can do something about it. This little guy is Domingos. And Domingos is 8 months old. And he was brought into the hospital with acute anemia. And malaria works on your body in many different ways depending on which strain of malaria it is. But in his case, it was attacking his red blood cells. It was causing them to swell until they burst open, and then the parasite would travel to other cells. And with that lack of red blood cells, the anemia was the cause of the anemia, and then the oxygen could not get through his bloodstream to the places it needed to go. And so what he needed was a blood transfusion. A blood transfusion gets those healthy red blood cells back into your body. But he's only 8 months old. And this was a hospital where they did not have a pediatric surgeon. And they were not able to insert a needle into his tiny, tiny veins. And so 5 minutes after this picture was taken, Domingos died. Now, pediatric surgeons are a skilled position, and so, sometimes it might seem understandable that there wouldn't be one at this particular hospital. But the photographer turned to the doctor and asked, what else could we have done? And the doctor said, well, if we had had oxygen, we could have put an oxygen mask on his face, and he wouldn't have labored in his breathing, and he might have been okay. And when I think about an oxygen tank and how simple that is and how easily available they are, we can do something to save lives like Domingos. And so that's why we're here. You guys have already talked about kind of our connection with Nothing But Nets, and in 2006 that campaign started. But in reality, this goes back years and years and years, because we've been in Africa for over 160 years. Our United Methodist Women and their predecessors, we've been building hospitals and clinics, we've been building churches. Our connections are deep there. Even our Iowa-Nigeria partnership is over 20 years old, so that we have a long history. So with Nothing But Nets, we were focused on Nothing But Nets. And so really that's kind of the need for this expanded program, is to really think in a comprehensive way about how we can make a difference. And so we have expanded that to think about treatment and education and communications. I think another significant milestone here is 2008, because this is when at General Conference we affirmed global health as one of our 4 areas of focus. And I really think that unites us as United Methodists around this. This is one of the 4 things we say we're about in this world. And Imagine No Malaria is really only the beginning of how we respond in that way. So I'm going to talk a little bit about these 4 aspects. First, prevention. We are familiar with nets, and we know that nets are the single most effective way that we can prevent malaria. They're not expensive. They're easy to distribute, easy to put up. They work. And so nets are certainly a big part of our prevention efforts. But so is the prevention of the breeding of mosquitoes that transmit malaria. And so we're also working to reduce standing water and stagnant water in those places where it pools. Clearing brush, lots of different ways we can act in preventative ways. But treatment's also really important. Anti-malarial drugs. There's also a rapid diagnostic test that we're using, and you can get results in 5 minutes from these tests. It used to be if you started to get sick in a village, you'd have to somehow get to the hospital to get your blood tested. Then you'd have to wait to find out if you even had malaria. You may have to go back home and wait for days. And this allows us to treat someone almost immediately if they actually have malaria. It's important that we not overtreat though, because if someone doesn't have malaria and they have something else, the malarial drugs can cause side effects, and you shouldn't just take them for the sake of taking them. So treatment is a big part of our program. Education is also really important, and this is actually one of the things I get most excited about with this program. We have established 15 boards of health, and we are training community workers to lead this program. These folks then are going back to their communities, and they are doing the training and the teaching and the implementation. They're doing the follow-up so that this program is sustained. We're not driving in and leaving some nets and then going home, but this is a program in which we get to partner and we get to allow the voices of the people to really dictate what they need, where they need it, and how it's being used. So I think that's really important. The last piece is communications. As soon as we have new advancements, you want to get them out. When you have best practices, you want to share this. And so we've been using radios, solar-powered radios, United Methodist radio stations, PSAs, and also cell phones for communication. And I think that's something that kind of surprises people sometimes. But I have a friend who worked in the Peace Corps. She was in Tanzania, and people in her village would call her up on the cell phone just to say good morning, and then they'd hang up. And it was just part of a daily ritual of communication. And so cell phones are certainly a part of our plan there as well. We are in this fight not by ourselves, but with a number of partners. The story goes that Bill and Melinda Gates, in their effort to do good in this world, wanted to tackle malaria, and they were traveling throughout Africa. Everywhere they went, they saw the cross and the flame of United Methodist Church. And so we'd worked with them with the Nothing But Nets campaign, but they also knew we'd be an effective vehicle for distribution, that we already had boots on the ground. We have a grant through the United Nations Foundation, and that money comes then from the Gates Foundation. That grant is what funds our campaign. And so my salary and the money that goes into all of our pamphlets and all the resources you can order, like our wristbands, all of that is paid for by the grant we received. So that means that every dollar we raise goes to the work we do, which is exactly the same thing we talked about with UMCOR. There's a lot of accountability, and there's really good stewardship of resources. The other partner I think it's important to mention is the Global Fund to Fight AIDS, Tuberculosis, and Malaria. This is a worldwide organization, but the United States government gives 1 out of every $3 to this global fund. And I think that's important to know because as the United States, we are leaders in global health. And we know that when we're able to be a force for good, that those dollars go very far. And we are in turn partnering with the Global Fund, and because of our work with them, we are the only faith-based organization that has a voice in the conversation. And that allows us to speak a lot of truth to power, I think. And it's a good place to be. When we think about this campaign, Imagine No Malaria, we have 3 goals. The first is to advocate, and then we raise funds, and then we engage our community. Advocacy is really about telling a story. It's about raising awareness, helping people to understand what malaria is and what we can do about it. Advocacy is also, however, about those voices that we have with the Global Fund, with our own United States government, to try to sustain that funding. So advocacy is kind of a really varied picture. Raising funds. Our goal with Imagine No Malaria is $75 million by 2015. And in Iowa, we've decided we want to raise at least $2 million to help support that. Our $2 million comes, we're hoping to have that by annual conference of 2014. And we'd like to get halfway there by this annual conference. When we talk about that number, we're talking about gifts and pledges, because pledges will come in over a longer period of time, but they count when they're made, so it's good to know. The third step, I think, really is important in Iowa. We get to do a lot for others, but I think this relates to how mission makes us grow as disciples. And when we engage our community, we get to build relationships with new people. There are a lot of people who are hungry to make a difference, and we have the opportunity to say, you know what, here's something that you can do. Let's partner together. This might be something at the halftime of a basketball game or a 5K run, or in Louisiana, I think they did a skeet shoot. They called it a skeeter shoot to raise awareness and to raise some money. So lots of ways to build relationships in this particular area. What we're going to do now is I'm going to walk through kind of what the plan is and what each of us can do. And we've got a district kind of level of this, and we've also got the local church level. So in the handbooks, page 2 has a lot of overview information like we just shared. But pages 3 and 4, if you can kind of look at these together, I think it's helpful to see them that way. There's 2 primary roles that we're thinking about on the district level. People who are ambassadors and folks who are organizers. The biggest difference between these 2 positions is organizers are how people. They're the nuts and bolts folks. And the ambassadors are the why people. They're the ones who are telling the story and sharing the impact of what we get to do. Both of these positions engage our local churches. And I think this is a really important part of our campaign, because we can talk about it all we want, we can send out letters and newsletter articles, but unless there's a person-to-person connection, unless someone calls up a pastor or a mission chairperson and says, hey, can I come talk to you about this? Then I think we lose that. We lose some churches in the process. And so the organizer's role is really to make those connections and work on that grassroots level. In that job then, there's some things that they do. They can help share the plan for local churches. They can make sure that there's follow-up. They can find out if resources are needed and make sure that kind of those steps are followed along the way. The ambassador, on the other hand, is a position where when there's a request for a speaker, that might be for youth group or worship on a Sunday morning, it might be Sunday school class. I wish I could respond to every single one of those, but I cannot be everywhere. And so the ambassadors are folks in the district who are nearby, who can then, when we have a request, I can call up those folks and who's available to share the story on this day. And so that's their primary role. The time commitment's not heavy with either of these, and they're fairly flexible. I'm going to talk about a way for the organizer position to really kind of be grouped together a little bit later in our training. They could contact each church that's assigned them individually, or they could call them all together at once and help train them together. So that's really the local church, or the district role. And on the local church level, on page 5, we have an overview of what we call the 5-step plan. This is really a bare bones structure. It's very flexible, but it's something that gives churches a place to start as they try to engage the campaign. So we're going to talk about each one of these steps one at a time. First, we want a church to set a goal. We want them to figure out how many lives they want to save. One of the places we want them to start is to think about saving 10 lives for every worshiper at their church. We're not talking about membership, we're talking about worshipers, so those active people who are involved. That would be $100 for each one of those worshipers. So a smaller church that worships about 30 on a Sunday morning would try to raise about $3,000 over a 2-year period. Church that worships 300 would try to raise $30,000 over that same time period. Now, that sounds like a big amount when you start to say it, but we really are challenging ourselves to think big with this, to really to give all we can to save lives and really engage this campaign. There are some churches who are in the midst of renovations and building campaigns and doing all sorts of other great work. And for those churches, we're also inviting them to think about tithing from that campaign. That's a way to kind of do both at the same time and make a positive impact as they're caring for themselves also. There are also churches who have endowments, foundations. Sometimes those, there is money set aside specifically for mission, and so that's a possibility. There are some churches who have used their foundations as a matching gift. St. Paul's in Cedar Rapids, for their Christmas offering, the foundation is matching every dollar that's raised at Christmas. So that's also a possibility for doubling the impact of your gifts. And there are some churches and some pastors who know that there are folks in their congregations who've been blessed to give and who would love to be able to offer a challenge gift to their congregation. To offer $10,000 for the congregation to match or something like that. So setting that goal is important, and then also seeing ways that you can exceed that goal is important. The second goal is to really tell the story, to build awareness, to advocate, and this is about education. This might be a Sunday school study, displays, this might be a sermon series. We are developing a youth group curriculum. It's about a 6-week study, and we're going to launch that at Youth Strike. So that's an opportunity to pick that up and share it. So I think when our youth get excited about this, the congregation catches on really fast. The third step is to plan an event that's going to help you accomplish the goals of this campaign. There are a number of things you can do outside the church to raise awareness. There's a whole sheet of activities in the packet that's there. Activity ideas like a bug smash and the 5K run and lemonade stands. But there are also things we can do inside the congregation that can help us cultivate that stewardship of our members. There's 2 types of events I'm going to talk about, and they're both described here. One of them is called Impact 100, and this is an invitation to folks within the church to consider giving at the $1,000 level. This is a gift of $28 a month over a time of 3 years. And we used to talk about buy a net for $10, save a life, so we're kind of continuing that idea of $10 saves a life. Now, this is the quickest and easiest way to save the most lives. And I think when we issue this invitation to people, and we break it down so that it's so simple, less than $1 a day, we realize the impact we can have. There are a number of ways to do this sort of an event. At a smaller church, this might look like coffee and donuts with the pastor after worship. In a larger church, this might look like a spaghetti dinner where there's an invitation offered as a part of the event. Talk about what Imagine a Malaria is, and I'll talk a little bit more about how to run one of those events later. The second aspect is really a congregational-wide special offering, a Sunday to Save Lives, where it might be the end of a series, a time where you really focus on this, and you put the offering envelopes in everyone's bulletins, and you have a chance for everyone to give something. Something that's really effective is if you have one or two of those Impact 100 events before your Sunday to Save Lives, and invite those who've given to offer testimony about why they felt called to do so, so that your churches are leading each other in this stewardship of gifts. The fourth step is to really make these gifts count. And this is the part of the program I think that can be the most complicated, how we actually record our contributions. And that's because we have two ways of doing this. The first way is to take our offerings like we are used to doing and send them into the conference on our church remittance form. And so you do that by marking the advance special for Imagine No Malaria. What happens in that process then is that it goes to the conference, and then it gets sent to the advance in New York, and then at the end of the month the advance sends the money to Imagine No Malaria in Nashville, which works just fine, and that's the system we're familiar with, so we can keep using it. What happens in the process sometimes, well not sometimes, all the time, is that we lose any individual donor information. And so when we send in gifts this way, the church gets credit, and the church gets a thank you, but individuals aren't given the opportunity to be thanked. And so our campaign has a form. It's this record of contributions form. And what we're encouraging the financial secretary, whoever counts the money to do, is to use this form also when sending in their gifts. Now this can be sent with the remittance form, and it'll come to my desk then instead of the treasurer's office. Will sort that out so that I can get this copy. I can then forward this to Nashville so that they have this individual donor information. And every person who gives will get a thank you. There are those who want to be anonymous, and that's okay. There's a place on the offering envelope to say that, or you just don't have to put those names here. These are not going to be used for any other purpose besides stewardship and thank you. So I think that's important to share. The other option for a church is to do the collection and to write that check on behalf of the church, and you can send it directly to Nashville. And you can include this form along with the check and send it straight there. Both work just fine. And when you send it to Nashville without going through the conference, you will still get conference Rainbow Covenant credit. You'll still get advanced credit. It filters backwards through the system. So it still works both ways.
One question I know is going to be asked.
Yes. Yep. Let's see. Okay, so that's our records. The last step is really to keep this going. We do not want Imagine No Malaria to be a one-time event for the church. We want this to be something that over the life of this campaign is sustained. But also we want global health to continue to be a focus of the church. So it might be Imagine No Malaria for the next 2 years here in our conference. But after we conquer malaria, there's other things that we can do. And so we want to kind of just keep this idea of doing something for global health present. And this might be an annual focus, this might be a quarterly event, this might be continued awareness building. But just to keep that momentum going is really important. Okay, so for about half an hour I've gotten to talk at you and share a lot of information really about the campaign structure. And so I want to ask right now, are there any questions about what we've covered so far?